all about sporting injuries. The shoulder. Acromioplasty, you have to take off part of the acromion when you perform an acromioplasty as part of rotator cuff repair. Different shapes of the acromion, which decide the amount that has to be resected at surgery. It's a technique for reducing dislocated shoulders called the scapular rotation technique. Dislocation of the sternoclavicular joint in a young patient can be anterior or posterior. If it's posterior, you have to pull it out. If it's anterior, probably leave it. Dislocation of the AC joint in a young male, prominence of the AC joint, seldom need to repair. It's a very severe AC dislocation. Could be called an ear tickler, may need to repair it. Again, dislocation of AC joint, this one doesn't need to be repaired. Anterior shoulder dislocation associated with fracture, reduce, follow carefully, may need to image, could require surgical repair to prevent re-dislocation. Typical posture of anterior shoulder dislocation, flattening the deltoid. Dislocation of the acromioclavicular joint, quite prominent. She may want a reconstruction in the chronic phase. Bilateral shoulder dislocations, epileptic, easily reduced. Same posture, both shoulders dislocated anteriorly. Another AC dislocation. Another AC dislocation. Typical posture, dislocated shoulder. This patient's got a hemiparesis from an acoustic neuroma. This is a luxatio erecta shoulder dislocation. The hand is above the head. There's a review of shoulder dislocations, with particular reference to a weakness, brachial plexus injury. I must document whether it's present before the reduction. Here's a fracture of the surgical neck associated with dislocation. Here's a fracture of the greater tuberosity associated with dislocation. What is this? It's a posterior shoulder dislocation. This left shoulder is locked in internal rotation, easy to miss. Axillary view will show the humeral head beyond the glenoid cavity. This is a posterior dislocation, but this is a voluntary one. Be careful operating on these patients. Symmetrical appearance of the humeral head. It's a posterior dislocation. It looks normal, but it's not. Examine the patient carefully. Again, posterior dislocation. Dislocation right sternoclavicular joint. And again, showing it very hard to image this area. Typical posture of anterior shoulder dislocation. Voluntary posterior shoulder dislocator. Be careful operating on these people. Shoulder strengthening exercises, Hippocratic technique for reducing a shoulder. Examination can tell whether the head goes back or forward in terms of instability. Instability being demonstrated in the posterior direction. The anatomy of the outlook view of the glenoid cavity. Acromioclavicular ligaments illustrated. Further anatomy. Major rupture of pectoralis major. Here, unusual, seldom need to repair it. Large hematoma in the pectoral region from avulsion of the pectoralis major. Major periscapular wasting. You can get that in rotator cuff problems. Complete rupture of pectoralis major here, deficit. Paralysis of the arm, radial nerve paralysis following fracture. Winging of the scapula, serratus, anterior nerve palsy. Positive impingement sign, rotator cuff problem. Patient rotator cuff repair, good result. This is swimmers are prone to rotator cuff problems. Large tear rotator cuff at arthroscopy. Again, slap lesion, labral detachment at arthroscopy. Arthroscopy of the shoulder, slap lesion here. Slap lesion, classification, slap lesions. The subscapularis lift-off test, problems of subscapularis. Biceps tendonitis, difficult problem associated with rotator cuff problems. bruising and long-headed biceps rupture. Rupture long-headed biceps. When it's ruptured below the lower end of the biceps, you need to surgically repair, but not when it's ruptured above. Popeye belly appearance. Phases of throwing problems, rotator cuff instability. Jurgensen's test for biceps tendon pathology, but generally palpated. That's the end of this presentation. Please look out for other series in the All About Sporting Injury series.